with Dr. Nitin Pai, the Director of Gastroenterology and GI Endoscopy. Welcome, Dr.
Thanks,
Nitin Pai.
Sonalee. Thank you, and we're really happy to be here. And to kickstart our podcast journey with you would be just amazing.
गणपती बाप्पा
Moria.
मोर्या मोर्या मला असं थोडं खूप दडपण आलं होतं when I said gastroenterology. मी बरोबर बोलले ना?
बरोबर बोललात. So it basically means all sciences which are related to your digestion. Anything in coarse terms from mouth till the backside belongs to gastroenterology.
Correct. So we are going to talk about this in a little more easier, comfortable way.
सगळ्यांना समजेल असं.
मला समजेल असं, which in turn will make sure that people understand.
Right.
So we are talking about, in short, gut health.
Correct.
म्हणजे it begins with what goes into the mouth.
Correct.
So what are those regular lifestyle issues, things that we must do to make sure that we are doing the right thing?
So I think in today's day and age, with pace at which life is lived, the food that we are consuming, the consumerism which has come into food, the lifestyle that we are leading, because of which there is no time for people. You know, they have got families which are both working, parents are both working. You're going to just pick up off the counter or ready-made food, heat food, that kind of life. We're more or less moving towards that Western concept.
Absolutely.
So जे commonly आपल्याला दिसणारे आजार आहेत आज, bloating, fullness, gas, acidity, dyspepsia, की डॉक्टर मला कसं तरी अनकम्फर्टेबल होतंय, मला भरल्यासारखं वाटतंय, फुगल्यासारखं वाटतंय, ऍसिड वरती येतंय, सारखंच त्रास होतंय, लेट नाईट झाला की त्रास, ऑड आवर झाला की त्रास, बिंज ड्रिंकिंग झाला की त्रास, ड्रिंकिंग झाला की त्रास. So these are the common things that we see.
I've not heard of binge
So
drinking.
binge drinking is the drinking which happens on weekends where you try and make up for the whole week because you've not had time.
Yeah.
मग उलटी येईपर्यंत पिणे, त्याला म्हणायचं binge drinking.
Wow.
And it is a common occurrence in this kind of, so our OPDs on Saturday evening till Monday morning see this concept very often. So you have this young IT crowd which, you know, goes all out on the weekends because they don't have time on the
Binge
remaining days.
watching ऐकलं होतं मी.
So binge drinking, and they end up in your casualties either vomiting or in altered sensorium or having severe gastritis or having, you know, food poisoning because they've eaten odd food, odd hours. So this is a common occurrence for our OPDs.
Oh, so that's the new thing that's happening.
It's not a good thing, but it's happening.
So it's connected to binge watching. म्हणजे बघता बघता काहीतरी प्यायला पाहिजे,
नाही,
बघता बघता
नाही.
काहीतरी
पिता
खाल्लं पाहिजे.
बघतात ते. बघता बघता पित नाहीत. पिता पिता बघतात.
So what do you have to say to these people?
आणि आता IPL आल्यावरती हे अजून होणार आहे.
बाप रे. So there is where we are going wrong. आपण येऊ त्याच्यावरती. आपण we will talk about what needs to be done, but let's understand what all can happen.
So what we should realize that digestion is a process which starts with what you select, how much you select, when you select, when having selected, the way you consume, having consumed, the way you digest, give it time, and thereafter whatever happens during the course of that digestion. जे आपल्याला वाटतं की सगळ्यांना सुरळीतप्रमाणे व्हायला पाहिजे, जेवण करणे, डायजेस्ट करणे, नेहमीसारखं वॉशरूमला जाणे, दुसऱ्या दिवशी वी आर बॅक टू स्क्वेअर वन, गेटिंग बॅक टू द सायकल. बट दिस इज नॉट, दिस सायकल इज नॉट as simple as it looks. So we have a lot of patients who come with this altered behavior in this form. So they will come with कधी पोट साफच होत नाही, झालं तरी अर्धवट होतं, साहेब फ्रेशच वाटत नाही, कसं तरीच होतंय is a very common. So there is no, so you keep asking कसं तरी होतं. नाही सर ते कसं तरी होतंय.
पण आता तुम्हाला कसं तरीला हे इंटरप्रेट पण करता येतं.
कसं तरी we have understood what it means. So often you will meet people, so you will be amazed at the kind of words there. So you will have, sir भरल्यासारखं वाटतंय, सर नळच फुगलेत. So what does नळ फुगले mean according to you? नाही सर ते जरा नळ फुगतात ना, तर माझे नळ फुगले. So these are the patients which come to you. So I mean this, so gas, bloating, fullness, tightness, this is part of your misdigestion. And that is where we realize that it's that kind of lifestyle which leads to these problems.
Now that brings me to diarrhea, the most common disorder.
So नळ उघडलेत जेव्हा होतात, त्यावर जेव्हा नळ उघडून येतात, so there is for us common ones which we get is something, one is called as traveler's diarrhea, आपण बाहेर गेलो, खाणं पिणं बाहेरचं झालं, you had these loose motions which go on for few days, you feel better, take an antibiotic, come back in few days. So this is a very common
When do
occurrence.
you know it's an issue now?
So it becomes usually an issue when you get that second cycle. So 7-10 दिवस हे चालतं, माझं सेटल झालं, मग जरा इकडचं तिकड झालं, I'm back to having diarrhea. So there is a concept here called as traveler's diarrhea, and it requires X amount of antibiotics for X amount of time.
Correct.
Every diarrhea need not be investigated. So we call chronic diarrheas as diarrheas which are more than a month.
Okay.
Those need investigations, and broadly they belong to two types. One is small bowel, किंवा छोटे आतडीचं, where actual digestion takes place, and the conduit is the large intestine, where the efflux takes place. म्हणजे पकडणं आणि काढणं हे मोठ्या आतड्याचा प्रॉब्लेम आहे. And by history we can make out which it belongs to, and then when we investigate accordingly. The ones who should seek help are ज्यांचं वजन कमी झालंय, those who have bled through the backside, those who are having mucus or shame जाते संडासातनं, पोट खूप दुखतंय, पकडता येत नाही, मी जर बसमध्ये गेलो तर मला वाटतं होऊनच जाईल. These kind of patients need to be investigated.
Right.
So if not run of the mill, at least this needs to be. And a very common concept today is something called as irritable bowel. म्हणजे ज्याचे ठोके आपण म्हणतो ना मराठीत, त्यांचे बदल आहेत. कधी कडक, कधी पातळ, झालं तरी साफ नाही, केलं तरी फ्रेश नाही वाटत. All those concepts is, so patients, this is a psychosomatic problem. म्हणजे अर्ध is physical, but there is a lot of functional overlay. So you feel that it is incomplete, you feel it has not done its job. So these are the patients which make up a large portion of our OPDs.
Right. So you said it comes from here.
It does come from here because finally a lot of lifestyle disorders which are so common are either related to stress, curry, worry, which we say ulcer कशामुळे येतो, हरी करी and worry.
Correct.
सारखं विचार करायचा, पळापळीचं जिंदगी, जे मिळेल ते हाणायचं,
गडबडीत
खायला काय खायला सकाळी आईने केलेले पोहे नाही मिळत, ते मग बटाटवडा 11 वाजता भेटला तो खाऊन घ्यायचा. So this is where we go wrong.
Right. I was actually going to come to the stress related gut issues that happen.
So like I said, so for ulcer in books it was written 100 years ago that hurry, curry and worry. So spices, altered lifestyle, stressful life. These are the ones which produce this disorder. But most somatic overlay, psychological overlays on all somatic. Somatic is what is organic.
Correct.
Psychosomatic is what overlays that organic. Right from acid, reflux, diarrheas, incomplete evacuation, bloating, fullness, tightness, gas, all have got stress related issues.
Okay.
So though it seems to be ह्याच्यात काय एवढं मोठं आहे, but patients, for them it's a big deal. So you need to be sure that A, we're not losing an organic cause, we're not missing sinister disorders, ulcer नाही ना, cancer नाही ना, वेगळा कुठला inflammatory bowel disease नाही ना. What you say, what you think is simple should stay simple at the end of your both history taking and investigations which you do.
पण stress related, gut related issues जे असतात ते कसे आपण curb करू शकतो?
See, as gastroenterologists we see it very often. If we have ruled out somatic cause, म्हणजे physical problem नाही आहे, then either we can prescribe ourselves or get some counselor on board or do refer them, because finally remember there's no, what do you say, you don't need to be ashamed to go and show mental health specialist.
Absolutely.
There's nothing to feel. It was much better to accept that I have a problem.
Yeah.
Or you need to maintain to them की बाबा तुमचं एवढं इम्प्रूव्हमेंट फिजिकली आमच्याकडनं होऊ शकतं, पण जे तुम्ही बघताय ह्याच्यासाठी we need help of a specialist. As you come to me, he's also a specialist.
Absolutely.
So might as well show him or her and get them on board so that we minimize medication, don't create any habit forming medications, and you also have some relief with that.
Correct.
So this is a very common thing which is being done now. So either, of course, we can prescribe because we are all MD medicine first and then we become specialists.
Right.
But it is better to take help of a counselor if required, because these kind of disorders are not going to go away. It's not a one-day job.
Correct.
This is tends to be chronic.
Right, right. And it needs to be having a long-term plan in place. You can't just treat it for, you can't treat the symptoms all the time.
I often tell my patients, ki younger patient, you should not be here. You're here because you're doing something wrong. You're spending on a doctor and medication and investigation where all you need to spend on is time, effort, lifestyle. And if you maintain your part, you don't need us. We are here only to take you there or tell you where you're going wrong. Because that's the real job. Our job is not to keep investigations and give you medications.
Yeah. Doctor, I've been a huge fan of Yakult.
Yeah.
So these probiotics, prebiotics, what do they actually do?
Basically,
Do you recommend?
let's put it. So all our life we have had curds.
Yeah.
आणि आजींनी सांगितलंय की दही चांगलं असतं, ह्याच्यासाठी चांगलं आहे,
मला तर-
पण दही माशांवर नका खाऊ, हे त्याच्यावर नका खाऊ.
हो.
So basic logic what is here is that what is a probiotic? These are good bacteria.
Correct.
These are ready-made bacteria which help you in digestion. When you give which gut anyway has, you append those bacteria which are good for you. What an antibiotic does, it kills the bad ones. What a probiotic does, it improves the good ones. This crossover takes some period of time. So this concept of probiotic, and then there's something called as prebiotic. Prebiotic is what? Food for those probiotics. I will give you a fiber, I will use certain foodstuffs, almonds. There are many such foodstuffs which are good source so that these probiotics can become much more.
Okay.
So you need to be careful when you prescribe. Most often, you should not alter milieu unless you know what you're giving. Because remember, the next bacteria around which comes, the antibiotics you're going to use are not going to work on them. So everything is good provided it's in proportion.
Correct.
Everything is bad when it's just not some run of the mill. And if I'm not mistaken, doesn't your Yakult have sugar? I think if you're going back to
I
it,
don't have it
if
anymore.
you're going back
There
to
was a phase.
it has sugar. व आपलं जे घरातलं दही आहे that is
ते
much
खायचं.
better.
So कधी prebiotics and कधी probiotics?
So like I said, ki usually you get a combination as pre and probiotic.
Okay.
The turnover rate of those probiotics to achieve adequacy is 6 weeks to 3 months. So that is the usual. 1.5 to 3 mahine is what we require. So whenever antibiotics are given, if you got some bacterial overgrowth, remember this to come down and that to take over has an overlap period. And the reason patients keep coming back is तुम्ही ते अर्धवट करा. 5 दिवस घेतलं आता तर बरं आहे, आता मला काही गरज नाही.
Correct.
10व्या दिवशी you are back with square one. So if you picked it up, you need to be treated adequately. Otherwise, do not expose yourselves to those antibiotics कारण नंतर resistance होतं.
Correct. या सगळ्या गोष्टींचा तो cycle period
So there is a cycle period. So you need to prove, and having proved, give adequate medication. Otherwise, you're coming back.
Right. So this is one of the signs. What are the other warning signs related to gut health?
So the worry today for us is we are in an explosion of two things. One is fatty liver because of the kind of lifestyle we lead, and second is cancers, which are coming at a much younger age.
Yes.
We belong to a country where roughage was part of our meals. Apple jevan is carbohydrate heavy. Ours is not raw meat. Ours is not. So our cancers are much less than that of the West.
Right.
In fact, West there is a concept called as you have to do colonoscopies at the age of 40 and every 5 years thereafter. And then the risk of colon cancer is so high. Large intestinal cancer because the diet is that way. Whereas ours, except a certain population, everybody we are basically carbohydrate, majority vegetarian diet. So we don't have those problems. So we were good till we were doing what we were good at. पण आज जेव्हा देशी माणूस अमेरिकेत जाऊन राहतोय, they have also developed colon cancers in their 40s and 50s. Why? Because the milieu has changed.
Yes.
The lifestyle has changed. The food habits have changed. The exposure has changed. The toxins have changed. The second generation, third generation are like any other Americans today. So we need to be aware. So there are certain things called as alarm symptoms.
Okay.
Whenever you get a patient with GI problems, with alarm symptoms, वजन कमी झालंय, उलट्या होत आहेत, रक्त जात आहे, संडासातनं रक्त जात आहे, वजन कमी होत आहे, खायसारखं वाटत नाही, खाऊनचं वजन कमी होत आहे, घरात फॅमिली हिस्ट्री ऑफ कॅन्सर आहे, घरात फॅमिली हिस्ट्री ऑफ लिव्हर डिसीज आहे. These are the patients whom you need to evaluate further.
Correct.
So these are the ones you cannot say की नाही काही नाही तुमचं घ्या गोळ्या खावत बसा. So you need to pick them up. So these are the ones you need to have a little bit of a viewpoint that we'll get the investigations done.
Right.
Other problem is fatty liver, and this is something which you really need to speak about. जे अगोदर म्हणायचो की सोनोग्राफी हा जराशी चरबी आहे, that चरबी is not, because we have a problem in this country called as we are subcutaneous fat is less, but our organ fat is very heavy. So if an American sits next to me and if we are of the same weight, suppose we are both 100 kilos, his organ is going to be much leaner than mine. His subcutaneously he is going to be much heavier. That is because of the way our diet is. So we deposit everything into our system. Their fat is related to their subcutaneous or maybe over their tummy. But their organs are lean and our organs are heavy. And today, as a liver transplant तुम्ही बघितला, the 30 to 50% of our patients are because of obesity, fatty liver, diabetes induced liver disease.
Right.
And this is something, this is purely lifestyle.
Oh.
So we need to be aware of this and need to be looking out for this. So this is something which is related to our diet, and because we are in an explosion of diabetes, so we are
Of course.
metabolic syndrome, insulin resistance, हा सगळा जो concept आहे that finally ends up in our liver.
Oh, so that is important. म्हणजे कॅन्सर शिवाय हा अत्यंत
This GI
धोका-
cancers who are coming at a decade, 2 decades, 3 decades before, liver diseases because of lifestyle, mainly being fatty liver. So these are the things which we need to look out, and our next 30, 40, 50 years of this country are going to be dealing with things which we did not exist here. So
Right.
आज जसं westernization झालेलं आहे, we're going to end up more or less moving in that direction.
Right.
Because in 25 years of this practice, I have seen we shifting a gear from what we never spoke about to what we are speaking on the day. We are having podcasts talking about these things, which we never would have spoken.
No, which is very important, and that's
We
why
were
we
discussing
started
only ulcers, and we were discussing diarrheas, and we were discussing a poor man's disease and running malnutrition and जेवायला नाही मिळत आहे. From there, we have reached a stage where there's an excess of everything.
Right. So, मगाचे warning signs लक्षात ठेवा. If you feel any of those, you know what to do. The next important question, doctor, I have is, there are a lot of myths around every, health issues. So, gut-related health issues से काय myths आहेत? Would you like to burst any of those?
So very often patients feel की जे मला आजार होते ते usually self-limiting असतात. Many a times they feel that we do not need to seek help over-the-counter medication. Everything is not just simple acid. You need to understand that these are the ones which need to see a doctor. In our country, because of OTC, which is over-the-counter drug,
Yes.
आज तुम्ही अमेरिकेत डॉक्टर बघायला तुम्हाला 3 महिने लागतील. प्रिस्क्रिप्शन शिवाय औषध मिळत
काहीच नाही. Antibiotics नाही मिळत.
अँटीबायोटिक तर विसरूच जावा. ओव्हर द काउंटर इज ऑल्सो रेग्युलेटेड दिस. One way it is good, but you cannot, here it is the other extreme. Today, the latest of medication, I can just, without a prescription, I can go and buy and nobody's going to question you. And this is where we partially treat, self-treat, wrongly treat, and then end up with problem. The patient who should have reached a doctor and got investigated at X time reaches 3 months down the lane, 6 months, they're become inoperable. So,
Yeah.
though you don't need to see a doctor for every occasion, but some things, alarm symptoms, family histories, complications which are known, you need to see. And as the way this country has developed, you got enough of gastroenterologists available everywhere. Pune, when I came, I was 6th. Today there are 60 gastroenterologists in Pune and another 60 within 100 kilometers of Pune.
Wow.
So this is the drainage. So we have percolated to super specialists, make use of them. When required, please see the right people, see the right doctors, because finally it's a specialty.
Absolutely.
So instead of wasting time, go ahead and show. Another common thing is that मला तर मूळव्याध आहे, संडासातनं रक्त पडलं म्हणून काय झालं?
It's not a big
So
deal.
it's not a big deal. It is a big deal. Bleeding is not normal. If you're bleeding more than 3 times in 3 months, it's not okay. You need to make sure, and everything is not piles.
Yeah.
So you have colon cancers, you have rectal cancers, you have inflammatory bowel disease. So these are those myths which we need to break.
Right.
And the last thing which we need to really be looking out for is, one is self-medication. Secondly, being conservative where we should not be. When you need to seek help, you need to seek help. Whether it is, women often avoid going.
Yeah.
They don't need to see a doctor.
Yeah.
तिकडची जागा कोण तपासणार?
Oh.
So that kind of concept cannot work. We need to be aware that there are problems, and you need to be upfront about this so that you see the right people. You may see a female doctor for all I care, but please do see someone.
There are options.
So these myths have to be busted. Availability is there. You seek the right people, and if you're in doubt, seek second opinions. There's no problem. There's no harm in seeking a second opinion. That we are okay with, but seek the right opinion. That's all.
Good. We were talking about IBS, irritable bowel
Irritable bowel
syndrome.
syndrome.
Main triggers का ऐसा, and how do you avoid these?
Irritable bowel syndrome is what all of us deal with on the daily. आज कसं तरी वाटतंय, भरल्यागत वाटतंय, नाही आज ते मला ते नको आहे, मला ते डायजेशनच बरोबर नाही झालंय, आज सकाळी नको खायला, मला काय तो म्हणजे उलटीच होऊन जाईल, रात्रीचं ऑड झालं, मग ते पोटच साफ नाही झालं, कधी साफ होतंय, कधी अर्धवट होतंय, कधी डायरियाच होतोय, कधी कॉन्स्टिपेशन होतंय, मला काहीतरी वेगळंच व्हायला
So there's something or the other constantly happening.
these triggers which are there. So though it is somatic for about 50, 60, 70%,
Yeah.
Those psychological overlays, those triggers, those stress factors, those orders, those lifestyle, those diets, those medications. Sometimes there are side effects of medication. You're taking a medicine for diabetes, you end up going to diarrhea 10 times a day. You don't even realize it's because of your medication. So we often there are antihypertensive drugs which we often end up taking, and you end up having diarrheal episodes. So there are side. You take blood thinners. तुम्हाला स्कॅन टाकलं होती ब्लड थिनर मिळतो. लोक ऍसिडिटी रक्ताच्या उलट्या काढून येतात त्या ब्लड थिनरमुळे. सो देर इज सम काइंड ऑफ इंटरप्ले बिटवीन मेडिकेशन्स, लाईफस्टाईल, डाएट and overall the speed of life that we're having. And we need to either take a step back, relax, look at the broader picture, and just Om Shanti, breathe.
Correct. Lastly, I wanted to ask you, food intolerances and digestive issues. What is the connection difference?
So, remember, food allergies are common. As a child, we are often exposed to multiple agents. As we grow older, our ability to fight those agents reduces. For example, milk. A child can consume a liter of milk. You try consume a liter of milk, you'll sit in the toilet. So that lactose intolerance is a very common thing.
Yes.
Similarly, we have wheat intolerance, which is gluten, which is very common. See, we are belonging to Western Maharashtra, jita millets was our staple.
Yeah.
Over the years, we have adopted gahu and maida as our staple, and jwari and bajri has gone behind because your regular millets are not being used. It's just a simple switch. It's not that you have gluten allergy. It means that you're finding it tougher as a youngster. So this, for example, the north of India, where wheat was the staple, you have a condition called celiac disease, which is gluten insensitivity, which is so common, and it's so myriad in its presentation. Short stature, recurrent diarrheas, liver diseases, inability to grow. It's so common, and all you need to do is just at the right age, you should just stop gluten.
Correct.
That's it. So these are simple things which are seen. So you need to be careful about them. Be aware that there could be allergies. Test yourself, whether it is skin test or blood test or whatever it is, and do a little bit of exclusion. Simply going back to what we came from.
Your roots. I was just going to say that.
Most of our problems.
Things that grow in your soil, eat that.
What is local? The vocal for local. At least for this, it's correct.
Absolutely. Ani, in the end, I want to just say, I recently heard somewhere that, जितकं घरचं, जितकं मातीतलं आपलं खाऊ, तितकं better, because we're ordering from outside, we're eating outside. That is the biggest issue.
I agree, but and also remember, unfortunately, at most dinner tables, when we finish our food, udya kya hai? We are obsessed with this concept, and whereas if you look at when you travel abroad, you say, for them just a cup of coffee and killing 2 hours is okay. आपल्या त्या कॉफीवर 2-4 कुकीज आणि खारीव आणि चकली आणि चिवडा गेल्याशिवाय आपण काही पिलं, चहा पिला असं वाटतच नाही. So we are obsessed with, we are a carbohydrate laden obsessed country who cannot change overnight, but we at least need to be aware.
Steps.
So that's what.
So and eat at the right time.
Right time. Try and have your last meal as early as possible. I mean, all the good things that you guys do.
Yes, fast, eat little, eat at the right time, and time is very important. That reminds me that our time here is over. We've had a wonderful chat, but I'm sure there are too many queries, too many questions that people might have. Well, you can, write down in the comment below, and I'm sure we here, not me, but our experts are here to answer all your other queries that you might have after this discussion. Thank you so much, Mr. Pai.
Thank you.
Doctor, तुम्ही खूप वेळ दिला आणि खूप व्यवस्थित समजवलं. I'm sure that I'm going to have a nice gut after this. I'm going to have my nashta. But yes, it is a pleasure talking to you and hearing from you about the regular issues that we have. And it was insightful for me. I'm sure it was insightful for you also. You must have learned at least a few more things about your gut issues. And I hope you will be closer to resolving them yourselves. But like he said, not everything is in your control. You need to go to the right doctor at the right time, get the right treatment. That's what we're talking about. When it comes to health, where you go first matters. Thank you for watching us.